one of the things that you probably see out there in the media and in the literature is, does sex addiction really exist? There's a lot of controversy out there about this. And really part of that is because we don't have an actual diagnosis right now. As many of you know, it's not in the DSM. And it actually, if you look at the history of the DSM, it used to be. In the DSM-3R, there was a category called non-paraphilic sexual addiction. There was a lot of controversy around that, and it was actually pulled out of the DSM. Part of that, there was some concern amongst the sex offender treatment community that it might be used to get sex offenders kind of off the hook, sort of like the insanity plea or something like that, and you know, it would be used in court situations. So really, it was pulled, and right now we don't have a diagnosis, which has just left the field bereft with a lot of controversy. If you look to the literature, the most common terms are sexually compulsive, sexually addictive, impulsive, and hypersexual behavior disorder. Now, one of the things that's very interesting is there's many authors that have conceptualized these different constructs, and really, if you look at how they conceptualize them and the criteria, they're almost exactly the same. Now, the addiction criteria are a little bit different in that it incorporates the ideas of tolerance, which is like you need more and more porn, for example, to get the same effect, and also withdrawal, which is that there's some distress when you can't access your behavior. So that's what sets the addictive model apart from the others. But right now, unfortunately, it's not in the DSM. So I'm just going to give just a general definition that's really easy to understand. Sex addiction is a pathological relationship to a mood-altering experience that's sexual in nature that, despite adverse consequences, the individual continues to engage in. Now, this definition is very straightforward. It's a little different than what the American Society of Addiction Medicine has out there. I won't read this whole thing to you, but it took 80 neuroscientists in 4 years to come up with their definition of addiction. And this came out in 2012. And the thing I want to point out to you is that ASAM has, in these past recent years, really acknowledged the behavioral addictions as addictions. So as you see in their definitions, they include food, sex, alcohol, and other drugs, other behaviors. So there is, in particular in the American Society of Addiction Medicine, more and more acceptance of the concept of behavioral addictions and looking at sex and porn as an addictive process. So it's very similar to chemical dependency. It can be used to numb feelings, escape the painful parts of life. It can be very mood altering, become central to life, feel like the most important need.